public health hazard that is entirely preventable. It is important for those who have questions about vaccines, especially parents, to speak with a reputable health provider. As with many topics, just because you found it on the internet doesn't mean that it's true. The science is sound. Vaccines save lives, the lives of those who receive vaccines, and the lives of those who are too young or vulnerable to be immunized. Before I turn this over to Senator Murray, I want to add that the National Child Vaccine Injury Act of 1986 required the Department of Health and Human Services to submit a report to Congress within 2 years after the legislation was signed into law. The HELP Committee has received 2 reports from the Department submitted to Congress May 4, 1988 and July 21, 1989. I ask consent that the reports be submitted to the committee record so they can be more accessible to the public. Senator Murray.
Thank you very much, Mr. Chairman. As Washington State and several other states grapple with measles outbreaks, this issue could not be more timely. I remember in 2000 when measles was officially eliminated from the United States, and what welcome news that was for families across this country. And I remember the years of efforts that actually led to that victory. Before the vaccine was available, measles outbreaks used to spread through communities like wildfire. If you were old enough to drive, odds were you'd already had measles. But today, vaccines that protect against measles have been in use for over 50 years. Like other vaccines, we know the vaccine is safe, it's effective, and it saves lives. Which is why today a generation of students are starting college, almost none of whom had to worry about a measles outbreak at school. It also means a generation of new parents may not appreciate just how dangerous measles is. Before introduction of the measles vaccine and widespread vaccination, millions of people caught measles annually, meaning thousands were hospitalized, hundreds of people died, mostly children under 5 years old. But measles isn't just deadly. It's also one of the world's most contagious diseases. It is easily transmitted through coughing and sneezing. It can linger in the air and on infected surfaces for 2 hours. It is already contagious 4 days before an infected person develops a rash, and then another 4 days after. 9 out of 10 unvaccinated people exposed to measles catch it. That's why the measles vaccine is so important in providing protection. Experts say in order to establish herd immunity against measles, in order to prevent an outbreak from occurring within a community, at least 95% of people should be vaccinated. Meeting that threshold is crucial to protect people who are unable to get vaccinated, infants, those with certain medical conditions. Unfortunately, while the national vaccination rate remains high, in communities across the country, we are falling behind. Vaccine coverage rates are declining in certain areas, contributing to the rise in preventable outbreaks, like in Clark County, Washington, where public health officials continue to respond to a measles outbreak. The immunization rate among children in that community is less than 70%, far below what is needed to keep families safe. The result is a true public health emergency, over 70 confirmed cases and counting, and the majority of cases have affected children under 10 years old who are unvaccinated. Each case isn't just a concern for family members who are worried about their loved ones who are seriously sick. It is a threat to neighbors and communities left struggling to get an incredibly contagious disease under control. It's a terror for parents with newborns who cannot yet get vaccinated, and a strain on our public health system as hundreds of staff in Washington State are pulled from critical public health roles to respond to this crisis. And the Centers for Disease Control and Prevention stretches to support the response to outbreaks in Washington and several other states. Measles isn't the only disease that deserves our attention amid slipping vaccination rates. Diseases like the chairman mentioned, mumps, pertussis, or whooping cough are also cause for concern. These outbreaks are a clear sign we've had to do more to address vaccine hesitancy and make sure parents have the facts they need to understand the science. Vaccines are safe and effective and life-saving. Parents across the country want to do what is best for their families to keep them safe, which is why they need to be armed with knowledge about the importance of vaccination, and why we need research into vaccine communication tools and strategies to help us better educate people to address vaccine hesitancy and build vaccine confidence. We also need to understand the roles social media and online misinformation play in spreading dangerous rumors and falsehoods. And we need to better prepare the full spectrum of healthcare providers, who are often the professionals people trust most, to counter vaccine hesitancy and promote vaccination. That's important not only for parents, but also for expectant parents who may already be deciding whether or not they plan to vaccinate, and for promoting adult vaccines and encouraging people to protect themselves and others throughout their lives. I look forward today to hearing from Dr. Weissman about how Washington State is working now to get parents reliable information about the importance of vaccination, and from all of our witnesses who are here today about how the federal government and other partners can promote vaccines and prevent the spread of misinformation. And while we are now fighting multiple measles outbreaks, it's important we also educate people on the HPV vaccine's role in preventing sexually transmitted diseases and lowering cancer risks, the flu vaccine, particularly on the heels of one of the most deadly flu seasons in years, the whooping cough vaccine, especially for those around infants who are particularly susceptible to the disease, and the value of other recommended vaccines. We also need to make sure we are approaching the public health challenges like this from a global perspective, because we know diseases are not stopped by borders or walls or bans. They are stopped by doctors and nurses and vaccines and public health awareness. And they're stopped by strong investments in public health systems here at home and abroad. They say an ounce of prevention is worth a pound of cure. That's certainly the case here. A dose of MMR vaccine covering measles, mumps, and rubella is about $20. Meanwhile, Washington State has spent over $1 million already addressing the current measles outbreak. Investing in prevention isn't just more effective at keeping our families and communities healthy, it is more affordable as well. The Vaccines for Children program is another great example of this. Over 25 years now, it has helped kids in low-income families get shots at no cost. It has saved $1.6 trillion, prevented 380 million illnesses, and saved 860,000 lives. That's more people than live in Seattle. So I hope we can work together in a bipartisan way to build on programs like this with strong steps to help address public health crises, and better yet, to prevent them from happening in the first place. And I'm glad to have this opportunity to learn more about how we can do that, and to consider how to make sure people across the country understand that vaccines are safe and effective to keep their families and their community healthy. And Mr. Chairman, I would ask that a letter from the National Association of County and City Health Officials be submitted for the record. It speaks to the important role of our local health departments across the country in responding to vaccine-preventable disease outbreaks and other emergency health threats.
So ordered. Thank you, Senator Murray. We'll now introduce our witnesses. Each one of you will have up to 5 minutes for questions and answers. I'll ask the senators, let's try to keep the questions and answers within the 5-minute period of time so everyone can have a chance to participate. Senator Murray will introduce the first witness.
Well, thank you again, Mr. Chairman. From my home state of Washington, I'm very pleased to introduce Dr. John Weissman. Dr. Weissman was appointed as Washington State Secretary of Health back in 2013, and his service there is just the latest in a 22-year career working to keep our families and communities healthy. Throughout his career, he's worked at 4 different health departments, including Clark County Public Health in Vancouver, which is the current front line of our measles outbreak in our state. And Dr. Weissman, I know some of my colleagues on the committee will appreciate learning that before you came to my state to work in our public health system, you got your education in theirs, receiving your bachelor's degree in Wisconsin, your master's in Connecticut, and your PhD in North Carolina. I'm glad we have you now in Washington State, working to help keep our families safe and healthy and respond to public health threats as we currently are. And I appreciate so much you coming out all the way out here from our other Washington.
Thank you, Senator Murray. Senator Isaacson, will you introduce our second witness?
Thank you very much, Chairman Alexander. I'm very pleased to introduce to the committee and everyone here today Dr. Saad Omer, and I believe that's the right pronunciation. Close enough, good. Well, mine's Isaacson, so I just want to make sure we got it right. We're very delighted to have him here today as an expert on the subject we're discussing. Dr. Omer is William H. Fogarty Professor of Global Health and Professor of Epidemiology and Pediatrics at Emory University, School of Public Health and Medicine. Dr. Omer also works in the Emory Vaccine Center, making him a well-qualified witness for today's hearing. His research includes studies in the United States and internationally, including clinical and field trials to estimate the efficacy of influenza, polio, measles, and other vaccinations. Dr. Omer has published approximately 250 papers in peer-reviewed journals and has served on several respected advisory committees and panels, including the U.S. National Vaccine Advisory Committee. He has also mentored over 100 junior faculty members, clinical and research postdoctoral fellows, and PhD and other graduate students, playing an important role in ensuring that the pipeline of qualified scientists is well stocked in the United States of America. Dr. Omer, welcome to the committee today. We're here for your expertise. We appreciate your testimony, and go Emory.
Thank you, Senator Isaacson. Third, we'll hear from Dr. Jonathan McCullers. He's chair of the Department of Pediatrics at the University of Tennessee Health Science Center, serves as pediatrician-in-chief at the remarkable Le Bonheur Children's Hospital in Memphis, received his medical degree and completed his internship and residency at the University of Alabama at Birmingham. In 1999, he was named a St. Jude Scholar in the Physician Scientist Development Program and joined the St. Jude faculty in the Department of Infectious Diseases, where he spent 13 years managing a translational research lab studying influenza viruses and bacterial pneumonia. In 2012, he joined Le Bonheur. He's published more than 150 peer review articles. Fourth, John Boyle. He's president and CEO of the Immune Deficiency Foundation in Towson, Maryland, which is focused on meeting the needs of people with primary immunodeficiency disease. Prior to joining the foundation, he worked for the Children's National Medical Center and the Platelet Disorders Support Association. He received his Bachelor of Science from Boston University, a Master in Nonprofit Management from Notre Dame of Maryland University. Finally, we welcome Ethan Lindenberger. Mr. Lindenberger is currently a student at Norwalk High School in Norwalk, Ohio. He's here to share his experience seeking out information about vaccines and making decisions about whether or not to become vaccinated. Welcome again to all our witnesses. Dr. Wiseman, let's begin with you.
Great. Chairman Alexander.
Dr. Wiseman, excuse me.
Very good. That's good. Chairman Alexander, Ranking Member Murray, and distinguished members of the committee, thank you for the opportunity to discuss public health's work in protecting people from vaccine-preventable diseases. Vaccines are safe, effective, and the best protection we have against serious preventable diseases like measles. Vaccinating children in the United States has saved millions of lives, increased expectancy, and saved our society trillions of dollars. My mission as Washington's Secretary of Health is to protect and promote the health of all its people and ensure our public policy is based on best available science. I want to speak directly to the parents who have children with serious health issues and who have been attending our hearings in Washington State and are watching this hearing today. I see your pain and your desire for answers to your children's health issues. Your mission to protect and promote the health of your children is one we share. While the science is clear that vaccines do not cause autism, we do need to better understand its causes. We need to develop together, affected families, scientists, and public health officials, research agendas to get the answers we need. State, territorial, and tribal local public health agencies are on the front lines. In Washington State, we provide all recommended vaccines without charge to all children under the age of 19. We provide an electronic immunization information system for healthcare providers to track vaccine dose schedules, provide reminders when patients are overdue, and measure immunization rates. We help parents make informed decisions by sending them the information they need to keep children healthy and publish plain talk about childhood immunization. And we assist school nurses by giving them access to the electronic immunization records. As of yesterday, Washington State's measles outbreak had 71 cases, plus 4 cases associated with our outbreak in Oregon and 1 in Georgia. Containing a measles outbreak takes a whole community response, led by governmental public health. The moment a suspected case is reported, disease investigators interview that person to determine when they were infectious, who they were in close contact with, and what public spaces they visited. If still infectious, the health officer orders them to isolate themselves so they don't infect others, notifies the public and about the community about the public places that they were in when they were infectious, and stands up a call center to handle questions. We also reach out to individuals who were in close contact with the patient. If they are unvaccinated and without symptoms, we ask them to quarantine themselves for up to 21 days. That's how long it can take to develop symptoms. And we monitor them so that we quickly know if they develop measles. If they show symptoms, we get them to a healthcare provider and obtain samples to test for measles. And if they have measles, we start the investigation process all over again. This is a staff and time-intensive activity and is highly disruptive to people's lives. Responding to this preventable outbreak has cost over $1 million and required the work of more than 200 individuals. So what do we need from the federal government? First, we need sustained, predictable, and increased federal funding. Congress must prioritize public health and support the Prevention and Public Health Fund. We are constantly reacting to crises rather than working to prevent them. The Association of State and Territorial Health Officials and over 80 organizations are asking you to raise the CDC budget by 22% by FY22. This will immediately bolster prevention services, save lives, and reduce healthcare costs. Second, our response to this outbreak has been benefited greatly from the Pandemic and All Hazards Preparedness Act, so thank you. The Public Health Emergency Preparedness Cooperative Agreement and the hospital preparedness programs authorized by this law are currently funded $400 million below funding levels in the 2000s. More robust funding is needed, and I strongly urge you to quickly reauthorize POPRA because many of the authorizations expired last year. Third, the 317 immunization program has been flat funded for 10 years. Without increased funding, we cannot afford to develop new ways to reach parents with immunization information, nor maintain our electronic immunization systems. Fourth, we need federal leadership for a national vaccine campaign spearheaded by CDC in partnership with states that counter the anti-vaccine messages, similar to the successful Truth Tobacco Prevention campaign. We have lost much ground. Urgent action is necessary. Everyone has a right to live in a community free of vaccine-preventable diseases. To make this a reality, we must continue to invest in and strengthen our public health system. Thank you.
Thank you, Dr. Weisman. Dr. Omer.
Thanks for the opportunity for me to talk about vaccines in this forum. Elimination of endemic measles transmission from the U.S. in 2000 is a significant public health success. Since then, most of the cases have occurred through U.S. travelers going outside and bringing it back. While recent measles outbreaks have been contained, the frequency and size of these outbreaks have been particularly alarming for those of us who follow these trends. The rest of this testimony will be focused on answering some of the salient questions that have been coming up. So the first question is, why haven't we seen a national level outbreak in the US? And we cannot take this for granted. Countries with similar development status, like Germany, France, and Italy, specifically more recently, have had national level outbreaks. And it is not a coincidence that we haven't seen similar national outbreaks, and there are several reasons for it. First of all, our laws, school-level mandates work, and they work by changing the balance of convenience. In most states, they work by changing the balance of convenience for vaccination compared to non-vaccination, by having physician counseling, or by having parents go through a video that talks about vaccines and the benefits of vaccines, et cetera. And the third thing is, in our country, medical societies like the American Academy of Pediatrics and the Infectious Disease Society of America have been very prominent in vaccine advocacy. And it is important because it's based on the fact that physicians are the most trusted source of vaccine information. So we have talked about the role measles has played in vaccine refusal, has played in these outbreaks, and I will just give a few numbers. For example, more than half of the cases since the elimination have been unvaccinated, and approximately 70% of them are unvaccinated due to vaccine refusal or non-medical exemptions. So there is a contribution of vaccine refusal in our epidemiology of measles. And vaccine mandates have been an effective tool in changing that balance of convenience that I was talking about. But that's a state-level issue. I will focus on some of the things the federal government can do. In my written testimony, I have provided a few more details on that specific issue, and I'd be happy to answer questions. So there are a few things the federal government can do. First, consider making vaccine counseling reimbursable. And I have worked on vaccine research in multiple countries and multiple states in the US. There are a lot of local factors that are specific, but there's one constant. Healthcare providers, specifically physicians, are the most trusted source of vaccine information even amongst those who are a little bit skeptical of vaccines. So we need to use that tool more effectively. On the practical side, physicians do not have the time to properly counsel patients using evidence-based approaches. And part of the reason, not all of the reason, is the fact that this is not reimbursable. So physicians lose money on this kind of important public health education. We should, as a country, the second point is invest in high-quality vaccine acceptance and communications research. And I often say that if we don't accept half-baked vaccine development science, and we don't, FDA goes through evaluation of the science from trials and basic sciences, et cetera, we should not be accepting of half-baked vaccine communications and behavioral science. And we have precedent in this country. For example, NIH's cancer prevention initiatives are a gold standard in these kinds of interventions and evidence-based communication strategies. NIAIDs, the National Institute for Immunology and, National Institute for Infection and Allergy, they have had very effective intervention development in the area of HIV/AIDS behavior. So we have that precedent in this country, and we need to invest in actual research. And before we develop evidence, while we develop evidence, there is an existing blueprint of interventions that the National Vaccine Advisory Committee put together. And unfortunately, not all of its interventions and its recommendations have been implemented. So that is ready to be implemented. And CDC plays this important role in fighting these fires, working with state and local health departments, which is somewhat unique in the developed world, so we need to support their mission. And we should continue to prioritize vaccine safety research, and I would want to thank you for bipartisan and consistent support for vaccines, because that matters. And that shows that there is broad societal support for vaccines. And those of us who work to protect children from these infectious diseases really appreciate that.
Thank you, Dr. Omer. Dr. McCullers, welcome.
Thank you. Good morning, Chairman Alexander, Ranking Member Murray, other members of the committee. My name is John McCullers. I'm the Chair of Pediatrics at the University of Tennessee and the Pediatrician-in-Chief at Le Bonheur Children's Hospital in Memphis. As someone who has devoted his career to the child health sphere, I truly believe there's no more precious resource than our children, and they should be protected by all means available to us. They really are the future of this nation. The childhood vaccination program in the United States has proven to be one of the most powerful public health achievements in our history. In the first half of the 20th century, there were more than 1 million infections and more than 10,000 deaths every year in this country from diseases which are now preventable by childhood vaccines. Measles alone caused more than 500,000 illnesses every year. Measles is a highly contagious viral respiratory disease characterized by fever, cough, sore throat, and a rash. It is a very dangerous disease. About 1 in 1,000 infected persons develop encephalitis, an infection of the brain. 1 in 1,000 develop severe pneumonia, and about half of those with those severe complications die. There is no specific treatment for measles, so vaccination is the only means of preventing these outcomes. With the introduction of a safe and effective vaccine for measles in 1963 and improved public health efforts to see that nearly every child received it, new cases of measles arising in the United States were entirely eliminated by the year 2000. Unfortunately, the issues of vaccine opposition and vaccine hesitancy are now impairing our ability to effectively ensure coverage, aided by state laws that make it easier to avoid vaccination. The last decade has brought numerous outbreaks to the United States, including several that are ongoing at present. These outbreaks are strongly linked to vaccine refusal and in particular to clustering of unvaccinated individuals in specific communities or regions. This problem is not limited to the United States, however. Countries worldwide are dealing with similar outbreaks. As a single example for the committee, there were 0 cases of measles in Brazil in 2017, but more than 10,000 cases occurred on a countrywide level in 2018 when infected travelers brought measles into that country. The vaccine against measles is very safe and very effective. 1 dose provides complete protection in about 93% of individuals, while a second dose raises that level of protection to 97%. Very few side effects occur. About 1 in 10 children experience fever for 1 to 2 days after vaccination, and about 1 in 3,000 to 1 in 4,000 have a simple seizure associated with fever with no lasting effects. Allergic reactions are very rare and typically very mild. When compared to the outcomes of the disease itself, it's easy to see why doctors and public health officials universally recommend on-time and complete vaccination. Unfortunately, vaccine refusal is high and getting worse in many states. This issue is complicated by the variety of state policies regarding exemption from vaccination and the methods of counseling about vaccines. The rate of parents claiming non-medical exemptions is about 2.5 times higher in states that allow both religious and philosophical objection. Evidence seeing that multiple pathways for exemption really worsens this problem. Social media is now driving a new phenomenon somewhat distinct from vaccine opposition, termed vaccine hesitancy. When parents get much of their information about health care issues such as vaccines from the internet or from social media platforms such as Twitter and Facebook, reading uninformed opinions in the absence of accurate information can lead to really understandable concern and confusion in these parents. They may be hesitant to get their children vaccinated without being provided with more information. The role of the pediatrician is very important, therefore, with these families. We must do a better job of communicating at many levels, but particularly at the point of contact at the well-child visit when vaccination should take place. About half of the time, when counseled appropriately, parents with vaccine hesitancy will agree to have their children vaccinated on time. And the other half, little seems to help at that stage, so the solution must be earlier, either in the form of policy or broader educational efforts. In closing, I'd like to thank the committee for addressing this important issue. Vaccine refusal is one of the growing public health threats of our time. If we continue to allow non-medical exemptions to vaccination, the rates of vaccine will continue to fall. More outbreaks will undoubtedly follow. As a leader at a children's hospital, I have a unique perspective on this, as children's hospitals are regional and sometimes national resources. Le Bonheur Children's Hospital sits in the corner of Tennessee next to Arkansas and Mississippi. Three states all have very different policies for granting exemptions to vaccines, which creates a tremendous problem for us and a threat to the children we serve, many of whom are too young to be vaccinated or are immunocompromised and more prone to severe diseases. I urge the committee to consider solutions that will both harmonize public health policy in this area and will also protect children as they grow up to become the next generation. Thank you.
Thank you, Dr. McCullers. Mr. Boyle, welcome.
Chairman Alexander, Ranking Member Murray, and members of the committee. Thank you for inviting me here to testify on the importance of herd immunity, or community immunity as we like to say, for vaccine-preventable diseases. My name is John Boyle, and I am the President and CEO of the Immune Deficiency Foundation, a not-for-profit patient organization that represents people with primary immunodeficiency diseases, or PI. Primary immunodeficiency diseases are a group of more than 350 rare and chronic disorders in which parts of the body's immune system are either missing or functioning improperly. There's an estimated 250,000 people diagnosed with PI in the U.S. alone. That's about 1 in 1,200 of your constituents. These disorders are caused by genetic defects and are not contagious. Now, there's a variety between the different forms of PI, but one thing unites all of us. We are immunocompromised, meaning that we are potentially vulnerable to even common viruses and bacteria. Now, I have a form of PI known as X-linked agammaglobulinemia, or XLA. I was diagnosed with it when I was 6 months old, when a respiratory infection nearly killed me. In short, I don't produce antibodies, but I'm able to be here with you today because I receive weekly infusions of antibodies from other people through a blood plasma product called immunoglobulin, or IG. These infusions give me back some of what I'm missing, but I'm still susceptible to infections. Now, because I was diagnosed early and I receive IG therapy, my health is better than most others with PI. However, a simple cold can wreak havoc with me or many other members of our community. we're incredibly vulnerable to communicable illnesses. Now, for some members of our community, infections are truly a life and death matter. I think all of you probably remember David Vetter, affectionately known as the boy in the plastic bubble, who was born with severe combined immune deficiency, or SCID. Children diagnosed with SCID, XLA, or any other form of PI face multiple challenges with simple everyday pathogens. Exposing these children to something as severe as measles could be life-threatening. Parents in communities where vaccine use is being questioned are afraid to send their children outside. They're afraid because they know the history, the science, and the math, and they know the stakes. If people stop vaccinating, the safety net of community immunity will fall, and their children will be among the first casualties. Now, of course, this does not just affect children, it affects adults too. While there's now newborn screening for SCID, most members of our community go years or even decades with serious and recurrent infections without knowing that they have a compromised immune system. And I'm particularly concerned for the health of this segment of our community, the undiagnosed. If community immunity fails, they don't even know that they need to take precautions. Those of us who know that we have PI do what we can to avoid exposure to infections, but the undiagnosed lack this basic knowledge and are even more at risk. Now, the reason that all of us are so dependent on community immunity and the PI community is that vaccines do not work with most of us who have forms of PI. Our systems either don't remember the pathogens or we physically can't create the antibodies. A further complication is that there are some vaccines that are actually dangerous to us, live vaccines. As a result, those in the field of immunology have studied this issue thoroughly to produce evidence-based guidelines to best safeguard those of us with PI. An article that I've shared with the committee discusses the issues surrounding which vaccines are either indicated or not, but it also addresses the growing neglect of societal adherence to routine vaccinations, what we're here talking about today. It states how important it is for family members and then those around patients with immune deficiencies to receive all available standard immunizations in order to protect the family member who has PI. Now, in closing, let me say this. My life, along with the lives of hundreds of thousands of others who are immunocompromised, depend on community immunity. We depend on vaccines. I understand the concern that some new parents have, particularly given the misinformation on social media, but that fear can't override the facts. History has shown us that vaccines work. Science has shown us that vaccines are necessary. And mathematics has shown us that the odds of children having a healthy life are magnitudes greater if they've had their vaccines. The current decline in vaccine usage is literally bringing back plagues of the past. While those of us who are immunocompromised will suffer first and suffer more, the loss of community immunity is a threat to all of us. We need to band together to dispel the myths, combat misinformation campaigns, and help ensure that measles and other vaccine-preventable diseases are once again put in their place, in history books and not in our communities. Thank you.
Thank you, Mr. Boyle. Mr. Lindenberger, welcome.
Thank you, Chairman Alexander, Senator Murray, and distinguished committee members for the opportunity to speak today. Good morning, everyone. As was stated, my name is Ethan Lindenberger, and I'm a senior at Norwalk High School. And my mother is an anti-vax advocate that believes vaccines cause autism, brain damage, and do not benefit the health and safety of society, despite the fact such opinions have been debunked numerous times by the scientific community. I went my entire life without numerous vaccines against diseases such as measles, chickenpox, or even polio. However, in December 2018, I began catching up on my missed immunizations despite my mother's disapproval, eventually leading to this story and being able to speak here today, and I'm very happy for that, so thank you. Now, to understand why I've come here and what I really want to talk about, I have to share some details about my home life and my upbringing. I grew up understanding my mother's beliefs that vaccines are dangerous, and she would speak openly about these views. Both online and in person, she would voice her concerns, and these beliefs were met with strong criticism. Over the course of my life, seeds of doubts were planted and questions arose because of the backlash my mother would receive, but over time, that really didn't lead anywhere. Now, it's important to understand that as I approached high school and began to critically think for myself, I saw that the information in defense of vaccines outweighed the concerns heavily. I began leading debate clubs in my school and pursuing truth above all else. And I realized one certain quality to debates and to conversations in general when it comes to controversial discussions, which is that there seems to always be two sides to a discussion. There always seems to be a counterclaim or rebuttal, and always something to strike back with in terms of debate. Though this may seem true in all instances, this is not true for the vaccine debate, and I approached my mother with this concern that she was incorrect. I approached my mother numerous times trying to explain that vaccines are safe and that my family should be vaccinated, approaching even with articles from the CDC, explicitly claiming that ideas that vaccines cause autism and extremely dangerous consequences were incorrect. In one such instance where I approached my mother with information from the CDC that claimed vaccines do not cause autism, she responded with, "That's what they want you to think." Skepticism and worry were taking the forefront in terms of information. Now, conversations like these reaffirm that evidence in defense of vaccines was, at least on an anecdotal level, much greater than the deeply rooted misinformation my mother interacted with. And that's what I want to focus on today. To combat preventable disease outbreaks, information is, in my mind, the forefront of this matter. My mother would turn to anti-vaccine groups online and on social media looking for her evidence in defense rather than health officials and through credible sources. This may seem to be in malice because of the dangers that not vaccinating imposes, but this is not the case, as my mother came in the sense of loving her children and being concerned. This misinformation spreads, and that's not necessarily justifiable, but I carry this knowledge with me that it was with respect and love that I disagreed with my mother. And with the information she provided, I continued to try and explain that it was misinformed. Ideas that, again, vaccines cause autism, brain damage, and also that the measles outbreak is of no concern to the society and to America were ideas that were pushed by these sources that she would go to. And for certain individuals and organizations that spread this misinformation, they instill fear into the public for their own gain selfishly, and do so knowing that their information is incorrect. For my mother, her love, affection, and care as a parent was used to push an agenda to create a false distress. And these sources which spread misinformation should be the primary concern of the American people. Although change is already placed, more strides can be done. Almost 80% of people, according to the Pew Research Center, turn to the internet for health-related questions. I further explain some more statistics and evidence in my written testimony. Now, in terms of what I would like to walk away with today and kind of finalize with, although my mother would turn to very illegitimate sources and sources that did not have peer-reviewed evidence or information, I quickly saw that the evidence and claims for myself were not accurate. And because of that, and because of my healthcare professionals I was able to speak with and the information provided to me, I was able to make a clear, concise, and scientific decision. Approaching this issue with the concern of education and addressing misinformation properly can cause change, as it did for me. Now, although the debate around vaccines is not necessarily centered on information and concerns for health and safety, this is why education is important, and also misinformation is so dangerous. Thank you.
Thank you, Mr. Lindenberger, and thank you for coming from Ohio to let us hear what you have to say. Now we'll begin a 5-minute round of questions. We have many senators interested. I would ask the senators to keep the combination of questions and answers within 5 minutes. Dr. McCullers, you're a pediatrician in chief at one of our country's leading children's hospitals, so your business is to talk every day during your career with lots of parents about their children. So what do you say to a parent who comes to you in Memphis and said, I've heard on the internet or I've read that vaccines cause autism and I don't want my child to be vaccinated? What do you say to that parent?
Well, what we find when we look at this is that parents really have a very complex set of issues that they're concerned about. That's one of them, but there's a lot of other things that they think about and that they bring to us. So it's not one issue that we have to talk about. It's
Well, but
many,
what if
many
they,
issues.
I want to focus on autism.
On the
Well,
autism.
what if they say that to you?
So this was
do
a concern that was raised about 20 years ago when there was a fraudulent paper published linking vaccines to autism
Now,
for
that
personal
paper was
gain.
published in the United Kingdom, is
It was
that right?
published in the United Kingdom.
In a
The person who-
respected journal, is that correct?
It was a respected journal. It was a physician who published it, and he was unfortunately paid by a set of attorneys more than £400,000 to falsify information because they were suing the government of England against vaccines. So this was found to be wrong. It was retracted. He lost his medical license.
What did the journal do about it?
The journal retracted the paper and said it no longer is valid.
Have there
The-
been other papers or journals that agreed with that physician's?
There have not been that agreed with that position. There have been numerous scientific research done in the interim that have shown the opposite, that these vaccines are not linked. And the Institute of Medicine here in the United States, our highest authority on these sort of issues, has declared that it's uniformly, basically a closed issue now.
As you talk with parents, though, is that persuasive with a mother who's concerned about her child and who's heard that vaccines cause autism?
I think if there is a rapport with the physician and a mutual respect there, both for the opinion of the parent, but then also for the position of the physician, you can say things like that and say the evidence is clear, I believe this, you should do this, and they will trust that information.
In your opinion, there's no evidence, reputable evidence, that vaccines cause autism?
There is absolutely no evidence at this time that vaccines cause autism.
Dr. Omer, do you agree with that?
Absolutely.
Dr. Weisman, do you agree with that?
I do.
Mr. Boyle, do you agree with that?
I do.
Mr. Lindenberger?
I do.
Dr. Weisman, what about state exemptions? You're a state public health officer, and as a former governor, I generally have a bias toward Washington not telling states what to do on many, except Washington. With Washington, D.C. not telling states what to do. Senator Murray's correcting me here. So what advice do you have about state exemptions and the effect on the concern we see today in pockets of measles across the country?
I think, as we heard earlier, that the choice to sort of make exemptions more difficult to get, to be sort of as burdensome as sort of not getting the vaccine, is incredibly important. In Washington State, as you know, we have 2 bills right now that are looking to remove the personal exemptions from vaccine for school entry and for child care entry. I think that's one of the tools that we have and that we should be using for this. I will also say in Washington State, another problem we have is that about 8% of our kids are out of compliance with school records, so that we don't even know if they're vaccinated or would like exemptions. And we have to tackle that problem as well, which really is a resource issue for schools and public health.
I'm going to stay within my time. Senator Murray.
Thank you very much. Dr. Weisman, I really appreciate everything you and your state and local colleagues are doing on the front lines of this measles outbreak in Washington State, confirming and managing the cases, tracing potential contacts, identifying exposure sites, crafting community messages. There's a lot going on, but it is really scary to imagine how much worse this outbreak would be if not for all the tireless work of so many public health officials on the ground. But we all hope we are able to not just respond to outbreaks, but also focus on preventing them in the first place. Mm-hmm. And I wanted to ask you, how have initiatives like the public-private partnership, Vax Northwest, and your department's proactive communication with parents of young children helped in building confidence?
Great, thanks. Yes, we do believe that the child profile mailings that go out to parents, to kids up to age 6, they go out at points in time that are appropriate to the development of the child. are incredibly important. It's a trusted source of information, not just on vaccines, but on childhood development. And it's that relationship that we build with parents through that mailing that I think is incredibly important. When I go out to the public and I see a new parent, I'll often ask them, hey, do you get this little mailing from the health department? And they say, do, we love it, it's great information. So I think that trusted source is really important. The public-private partnership that we have with Vax Northwest is actually a research initiative to try and best understand how we actually address vaccine hesitancy. There have been 2 studies done, one looking with healthcare providers on how to best train them around communication with their patients. Unfortunately, that work didn't find that it made a difference in terms of addressing vaccine hesitancy, nor necessarily healthcare providers' efficacy around feeling confident in those conversations. The other piece was one with parents, and parents who were interested in vaccine advocacy, training them on how to have conversations with parents, how to share information at PTA meetings, et cetera. And that did find that it increased parents' knowledge of vaccines and reduced their hesitancy.
Okay, thank you. And Dr. Omer, as vaccination rates in some areas drop below levels, we need to keep each other safe. Your research on vaccine hesitancy and likewise is really critical. And we know that some parents are making decisions about whether or not to vaccinate before they even have their child. I wanted to ask you, what are the implications of some of these early decisions, and what have you learned about the key factors that lead some parents to hesitate to vaccinate?
Thank you for the question. And you rightly pointed out that there's evidence to suggest that a lot of parents are making the decisions around vaccines before the baby is born. After the baby is born, it's like a fast-moving train, and parents go through this extended jet lag. And so before that, there's a lot of discussion happening, et cetera. And there are several reasons for this. The first one is, the big picture reason is that vaccines are a victim of their own success. And as the rates of vaccine-preventable diseases go down because of vaccines, successive cohorts of parents see and hear about real or perceived adverse events and not the disease. And what happens is that mental calculus changes. And in that milieu, they interact with several local factors. And in the US, for example, we have, due to that sort of change in the disease rates, which is a good thing, we have less appreciation of vaccine susceptibility and severity and more questions about vaccine safety. Yeah. And so in that context, focusing on not just childhood, but before the baby is born, we are working, for example, our group is doing a randomized controlled trial in collaboration with the University of Colorado and Johns Hopkins, where we are, and this is due to an investment, due to funding from the National Institute for Allergy and Infectious Diseases, where we're looking at bringing together the best evidence and packaging it and seeing if that has an impact, not just maternal vaccination, but this intervention being performed in pregnancy leading to childhood vaccination rates increase. And so the initial results from them are promising, but to come back to the idea that we need to continue to invest in the best science for vaccine behavior and communication as we do for vaccine safety and vaccine efficacy.
Okay, thank you very much. Thanks.
Thank you, Senator Murray. Senator Isaacson.
Thank you, Chairman Alexander. Thank you all for your testimony. Mr. Lindenberger, what year in school are you?
I am a senior in high school.
When did you start doing the investigation and research on vaccination?
So for my mother specifically, I mean, she would vocalize her views on vaccines throughout my entire life, and it was a slow progression to start to see evidence as I would see people, try and counterclaim with her and argue online. I would see that she would have this backlash as she would share information. So on Facebook, she'd share a video, and people would be like, that's incorrect, this is false. And so as a child, that intrigued me, that people disagree with my mom, and I slowly look into it over the course of multiple years.
That's the second time you've used online in your answer. I want to add, did your mother get most of her information online?
From what she's presented, yes, either through Facebook or through sites that use the social media platforms like Facebook and other, mainly Facebook. I mean,
where do you get most of your information?
From not Facebook. I mean, from CDC, the World Health Organization, scientific journals, and also cited information from those organizations like the Institute of Medicine, Trying my best to also look at accredited sources.
I'd love to be a guest at Thanksgiving dinner at your house. That'd be a heck of a discussion everybody would have. I know that. Dr. Omar, thank you for being here, and thanks for the work that Emory does. Emory does a phenomenal job in infectious diseases and all kinds of things like that. What currently, are there any things on the horizon that would join this group of people that we might want to be immunized for later on?
So there's several exciting developments, and one of the big gaps in vaccine has been the fact that there is the gap of vulnerability between the baby is born and when we start vaccinating them. And that's due to immunological reasons. And one of the more exciting developments in this area is the area of maternal immunization, where you vaccinate mom, and I had the privilege of being involved with some of those trials, et cetera, to protect not just the mother, but the baby as well. So there are vaccines against the respiratory syncytial virus, which is the biggest cause of viral pneumonia in the world, that are on the horizon. So there's a variety of vaccines being developed. There is a vaccine that is being developed against group B streptococcus, et cetera. So there are several vaccines on the horizon. The field is expanding.
Now, would those vaccinations take place in the mother before the baby is delivered?
Yes.
So it transfer to the baby during the course of gestation?
Yeah, exactly. And our first trial was had a name of Mother's Gift ages ago. And I think it's an appropriate name for this kind of a strategy where maternal antibodies protect the baby.
You know, I've been to Africa with CDC a number of times and seen your work, the work in the field that they do. I don't know of any organization that does more for healthcare in our country than CDC does. How much do you use CDC for as a resource in your work at Emory?
A lot. So CDC is a national treasure. And the firefighting function that I talked about, they perform with the state and local health department, is somewhat unique. For example, the European CDC is relatively new and has a very narrow mandate. And people who have looked at the effectiveness of national public health agencies in Europe have clearly come out with the understanding that our CDC is very strong, and I'm not trying to put down any other country's public health agencies because they are trying their best, but the kind of investments that have gone into building this cooperative framework of the CDC being the premier technical public health agency, but working closely with the state and local health department has served us really well, including in this area.
I don't think you're putting them down at all. In fact, to tell you the truth, it's the world's healthcare center at CDC, and we are lucky to have it in the United States of America, but the world considers it their health center, and they're doing a better job. CDC is doing a better job of incubating CDCs in other countries now to replicate what they do in countries that are more developed and populated. So they're a great resource, great help, and great service. And I thank all of you for being here today. And Ms. Lindbergh, don't forget, I'd love to come to Thanksgiving dinner one day and just meet you in your mom. Thank you, Mr. Chairman, or Madam Chairman.
Senator Baldwin.
Thank you. In 2015, this committee held a similar hearing to discuss the resurgence of vaccine-preventable diseases in response to a multi-state measles outbreak. Our nation's vaccination program has saved lives by preventing and reducing the outbreak of vaccine-preventable diseases like measles, which has one of the most effective vaccines. So I am troubled that we are here again facing another preventable outbreak in several states that has similarly been exacerbated by a surge of misinformation surrounding vaccine safety. I believe we must do a better job to prioritize investments in cutting-edge science and public education surrounding vaccine safety. Younger children and those with compromised immune systems have a higher risk of measles complications. And with the breadth of misinformation proliferating in the media and online about the science behind vaccines, Dr. Weissman and Dr. Is it Omer?
Yes.
Omer, what role do state health departments play in arming community leaders like school officials and providers with accurate information and scientific resources on vaccine safety? And as a follow-on, what can Congress do to improve the public health education so we don't see another preventable outbreak in the future?
Thank you for that question. Yes, so states and local health departments really are the leaders in communities around these health strategies to engage their communities